Good day. So today, I will be performing emergency management for shoulder dystocia. So, first step, gather all items you will need for internal examination. As usual, before doing any procedure, we have to identify the client, introduce yourself, and explain all the procedure. I will show you an example. Good afternoon, ma'am. I am your nurse for today. I am Ara, and I will do internal examination. I will insert my 2 fingers to examine the progress of labor. After introducing yourself to the client, position the client on the examination table, and in shoulder dystocia management, there are 3 positions to be employed for internal examination. First, dorsal recumbent. Second, Sims position. And lastly is the knee chest position. So I will show you how I position my patient in knee chest position. Ma'am, please cooperate. Can you do knee chest position with me? Once the patient is positioned, drape the patient to secure privacy for the patient. You can now perform hand washing and put on your examination gloves. So, ma'am, I have done hand washing and put on my examination gloves to assess the progress of your labor. And then, after explaining the procedure to the patient, you can now assess the progress of labor by inserting your 2 fingers into the vagina. During the emergency delivery, notify assistant or backup to enlist other appropriate healthcare providers, including those healthcare providers skilled in neonatal resuscitation. But first, you have to explain it to the patient. Okay, ma'am. So, I have notified other healthcare providers to assist me or back me up during the emergency delivery and neonatal resuscitation. Next step is to perform Mac-Roberts maneuver. So, let's explain to the patient what Mac-Roberts maneuver is. Okay, ma'am, so now I will perform Mac-Roberts maneuver, and I will be grasping your posterior thigh and flex them against your abdomen. Is that okay, ma'am? Now, let's instruct the patient to do the procedure with us. Let's push your thigh against your abdomen. There. This is what Mac-Roberts maneuver looks like. After performing the Mac-Roberts maneuver, next is the Mazzanti maneuver, and this is done by applying suprapubic pressure applied with the heel of clasped hands and from the posterior aspect of the anterior shoulders to dislodge it. Clasp our hands. In doing the Mazzanti maneuver, it is important not to use fundal pressure. After the Mazzanti maneuver, next is the Rubin's maneuver or the reverse wood screw. And this is done by adduction of the anterior shoulder and by pressure applied to the posterior aspect of the shoulder. So this is how the Rubin's maneuver is done. So I have to put my fingers inside of the mother's vagina. Next is the rotation of the posterior shoulder wood screw maneuver. And this is done by applying pressure to the anterior aspect of the posterior shoulder and an attempt is made to rotate the posterior shoulder to the anterior position. So I will have to put my 2 fingers inside. Next is the manual removal of the posterior arm. This is when the arm is usually flexed at the elbow. If it's not, pressure in the antecubital fossa can assist with flexion. Next procedure is the episiotomy, but this procedure should be done by the obstetrician only. Okay, 1, 2, 3, push. 1, 2, 3, push. Once the baby is delivered, call out the time of birth and announce the gender of the baby. So, April 10, 10 a.m., baby girl de la Cruz.
After the delivery, assess the baby's motor reflex, check for fractured clavicle or humerus.
Next is to assess the mother for postpartum hemorrhage. After assessing for the postpartum hemorrhage, you can now take off your gloves to avoid transfer of microorganisms. After removing your gloves, don't forget to perform proper hand washing technique. For the final step, prepare the documentation.